Doctor, I can get an erection, but I lose it during sex. If you're over 50 or 60 and this keeps happening to you, listen very carefully, because this is one of the most common problems men quietly suffer from, and most men have no idea that a few simple changes can completely transform their performance in the bedroom. In fact, many men think it's just age and nothing can be done, but the truth is, losing an erection during sex is often your body trying to warn you about something deeper happening inside your blood vessels, hormones, or nervous system. Before we continue, please take a second to like this video. It really helps us reach more seniors who need this information. And if you have any doubts or questions related to erections, prostate health, or men's health, write them in the comments below. I personally read them. And of course, subscribe to our channel so you don't miss the next videos where I share doctor-backed advice to help you stay strong, energetic, and confident even after 60. Now let me tell you about one of my patients, Michael, a 64-year-old retired engineer. Michael came to my clinic extremely embarrassed. He told me, "Doctor, I can get hard in the beginning, but during sex I suddenly lose it. It's humiliating." His wife thought he was no longer attracted to her, and Michael was starting to avoid intimacy completely. But after examining him and making a few specific changes to his routine, within 8 weeks his erections became significantly stronger, and he was able to maintain them during intercourse again. And this story is not rare. Studies published in the Journal of Sexual Medicine and European Urology show that nearly 40% of men over 50 experience difficulty maintaining erections during intercourse, and the number increases to more than 60% after age 65. But here's the good news. In most cases, this problem is reversible. So today I will explain the 5 most effective doctor-recommended ways to stop losing erections during sex and stay hard all the way. Let's start with the first and most important reason: blood flow to the penis. You see, an erection is essentially a hydraulic event. When you are aroused, blood flows into 2 chambers in the penis called the corpora cavernosa, causing them to expand and become rigid. But if blood flow is weak, the erection becomes unstable and disappears quickly. Research from the American Heart Association shows that erectile dysfunction can appear 3 to 5 years before heart disease symptoms because the penile arteries are much smaller than the arteries in your heart. Even slight narrowing due to cholesterol, plaque, or poor circulation can cause erection problems. One of my patients, Carlos, age 69, had exactly this issue. He was losing erections during intercourse even though his desire was strong. His blood tests revealed high LDL cholesterol and early signs of vascular stiffness. After we improved his circulation with diet, walking, and specific supplements, his erections improved dramatically. So the first best way to stop losing erections during sex is to improve your blood circulation every day. The most powerful method? Walking for 30 minutes daily. A major study from Harvard Medical School found that men who walked 30 minutes a day reduced their risk of erectile dysfunction by 41%. Walking improves nitric oxide production, the molecule that allows blood vessels to relax and expand, and nitric oxide is absolutely essential for maintaining erections. The second major cause of losing erections during sex is low testosterone. Testosterone is the hormone responsible for sexual desire, erection strength, and overall male vitality. After age 40, testosterone levels decline about 1% per year, according to research in the Journal of Clinical Endocrinology and Metabolism. By the time a man reaches 60 or 70, levels may drop significantly, which can lead to weaker erections, reduced stamina, and difficulty maintaining arousal. I remember a patient named David, age 62, who complained that he could start sex normally but would lose his erection halfway through. His blood tests showed his testosterone was borderline low. We worked on improving his sleep, resistance exercise, and diet. Within months, his testosterone increased naturally and his sexual performance improved. This leads us to the second powerful solution: strength training. Lifting weights or doing resistance exercises 2 to 3 times per week can significantly boost testosterone levels. Studies in the European Journal of Applied Physiology show that resistance training stimulates hormonal responses that help maintain male sexual function. Even simple exercises like squats, push-ups, and resistance bands can make a big difference. Now, the third reason men lose erections during sex is psychological pressure. This is something many men underestimate. When a man becomes worried about losing his erection, the brain activates the stress response, releasing cortisol and adrenaline. These hormones constrict blood vessels and shut down sexual arousal. It becomes a vicious cycle. The fear of losing the erection actually causes the erection to disappear. I had a patient named Robert, age 58, who told me he would get anxious every time intimacy began because he was afraid of failing again. That anxiety alone was enough to interrupt the erection. Research from the International Journal of Impotence Research confirms that performance anxiety is responsible for a large percentage of erection loss during intercourse. The third solution is surprisingly simple: slow down and focus on relaxation and foreplay instead of performance. When the body feels safe and relaxed, the parasympathetic nervous system activates, which is the system responsible for erections. Deep breathing, emotional connection, and slower intimacy can significantly improve erectile stability. Now let's talk about the fourth powerful fix: pelvic floor strength. Most men have never heard of this, but the pelvic floor muscles play a major role in maintaining erections. These muscles help trap blood inside the penis during arousal. If they are weak, the erection can fade quickly. A landmark study published in the British Journal of General Practice found that men who performed pelvic floor exercises for 3 months experienced significant improvement in erectile function. These exercises are often called Kegel exercises for men. To perform them, simply tighten the muscle you would use to stop urinating. Hold it for about 5 seconds, then relax. Doing 10 to 15 repetitions 3 times per day can strengthen the muscles responsible for maintaining erections. Many of my patients notice improvement within 6 to 8 weeks. Finally, the fifth and often overlooked reason men lose erections during sex is poor sleep. Sleep is when your body produces most of its testosterone and repairs blood vessels. Research from the University of Chicago found that men who sleep less than 5 hours per night can experience a testosterone drop of up to 15%. Poor sleep also reduces nitric oxide production, which directly affects erection quality. I once treated a patient who worked late every night and slept only 4 hours. His erections were extremely inconsistent. When he improved his sleep to 7 hours per night, his erectile function improved dramatically. So the fifth solution is simple but powerful. Prioritize 7 to 8 hours of quality sleep every night. When your body is well rested, hormones stabilize and circulation improves, making erections stronger and more reliable. Now let me summarize the 5 best doctor-backed ways to stop losing erections during sex. Improve blood flow with daily walking, boost testosterone with resistance training, reduce anxiety and slow down intimacy, strengthen the pelvic floor with Kegel exercises, and prioritize quality sleep every night. These 5 strategies target the root causes of erection loss, not just the symptoms. And scientific research consistently shows that when men address circulation, hormones, muscle strength, and stress levels, sexual performance improves naturally, even after age 60 or 70. Remember, losing erections during sex is not something you should feel ashamed about. It is incredibly common and often reversible. Your body is simply giving you signals that certain systems need attention. When you respond to those signals the right way, you can regain confidence, intimacy, and vitality again. And if you found this information helpful, please like this video. It helps us reach more men who may be silently struggling with the same issue. If you have any questions or personal experiences related to erections, sexual health, or aging, write them in the comments below. I read every comment and try to guide as many people as possible. And don't forget to subscribe to the channel, because in our next videos, I will explain the foods, vitamins, and simple daily habits that can naturally strengthen erections and improve men's health after 50, 60, and even 70. Your age does not define your vitality. Your daily habits do.